trouble with? Is it your knee?
Yeah, it's my knee. It's just on the inside right there.
Okay.
My right knee there.
Any other problems? Just that?
Yeah, just my knee.
And does that happen when you're squatting?
Yeah.
Okay. Have you gone up in weight?
Yeah, a lot.
A lot.
Since I first started seeing you, I've gone up quite a bit.
Okay. And you use spray as well, do you?
Yeah, I have the one spray, but I haven't been using that. I've just been using the clips.
You'd be using the clips.
Yep.
Okay, that's fine. Well, let's get you lying on your back, please, and we'll see if there's anything out of line. All right, so first test we're going to do is a very simple muscle test to see how you resist with your rectus femoris, okay? And you lock it very nicely. How about the right one? And hold. Now, if I let you go back to here, you're not using rectus femoris anymore. You use iliopsoas and a bunch of other muscles. But if this is a pure rectus femoris test at this angle, and you're pretty strong, all right? So we use the rectus femoris as an indicator muscle. So we'll take one device, first of all, and test this one. All right, it's normal, and we'll put another one in line with it on the conception vessel, and you immediately go weak, and that's normal. So now we'll place one on your governing vessel, and you go weak as well, and that's normal. So this is testing polarity, and when we test here and here, it's for neurological disorganization. This is for polarity, all right? So now we're going to use, and lift your head up for me. There you go, that'll be better for you. Now we're going to just simply test to see if you have a disconnect between your knee and your motor cortex, because these ligaments obviously here should be sending information to your brain. Your brain adjusts for that information and makes the muscles of your leg work optimally to support your knee, okay? So let's first of all test to see if you've got a disconnect at the lateral part of your knee, okay? Pull back, please. No. Let's try the medial portion. Resist. No, you don't. There's nothing there. I don't find anything wrong there. Let's find out if you have an ankle disconnect. Pull back, please. Normal. Okay. And now lateral part of your ankle, and now medial. Okay. The medial talus. We call that a medial talus restriction. And I notice that you pronate quite a bit too, so your foot is flat on this side, okay? Yeah. So it's going to make you more susceptible to your talus moving inwardly. But you'll notice that you're completely weak there, all right? So to correct that, we're going to just tap this over the motor cortex, over the motor strip. Because the devices resonate with one another, they send a signal up through, they meet at the motor cortex. This resets its receptors, and now you're strong. Okay? Now, that may be one of the reasons why you keep getting a medial knee problem, but you also could have a right pelvic problem. So let's test the left SI first. We'll put this right on your left SI, right there. Okay? So there's a device here for testing whether or not those proprioceptors are connected. Pull back, please. Left SI is connected very nicely. Now let's check the right SI. So right over the SI joint, and let's lay it back. And we'll just use this. Doesn't matter which muscle you use, okay? And you'll notice that you're very, very weak. Now, when you have this problem, you have to, that is, when you've got a disconnect of your SI, it could be your SI contributing to your talus. It could be your medial talus causing your right SI. Whatever, both of them have to be fixed. But what we do know is that when you have a right SI problem, there are groups of muscles that are not working properly to support your knees and obviously your back. So let me show you very quickly one set of muscles that are probably shut off in your case. So sit up for me, please. I find this even with elite athletes that they have an SI joint lock or an L5-S1 lock, and they have groups of muscles that are just switched off, and they just cope with that switch off. So they're not optimized when they either go on the ice or on the field or whatever. So turn your body this way. I'm going to hold your ankles to support you, and I'm going to test your obliques, which looks strong. Let's see. Really good. So I'm basically going shoulder to shoulder, and you're strong. I have to lean into you to engage that muscle. Let's do it this way. Okay, hold there. I'm going to put a little pressure, and you feel like you're going to fall off the couch, correct?
Yeah.
I'm going to give you one more time. Try, and resist as I push, and you can't do it. All right. So that's typical of what happens when your SI is locked. The oblique and the transverse abdominis are weak on that side. Now you could have a TFL, a gluteus medius issue as well, and you almost certainly will have a Sartorius issue. Okay, let me test the Sartorius on you. First of all, let's do the left Sartorius. So the Sartorius is tested like this. All right, so it's this L shape. I'm going to put my hand here, and you're going to maintain the L while I kind of pull and straighten your leg, okay, on this left side. Okay, so the Sartorius muscle, which again is helping your knee, is great on this left side because your pelvis is normal on the left side. Well, let's see what happens when the right Sartorius is tested. Quite a difference?
Yeah.
Okay. Well, the other thing, Robert, is that your gluteus maximus is almost certainly going to be weak. But let me test your TFL first of all. Right? Turn your toe inwards, please. Okay? I'm going to press in this direction, right? From one foot to the other. Okay. Very good. Let's try this one. And resist. Okay? You can't do it.
No.
Okay. So you can just imagine during a deep squat how much you have to recruit other muscle groups to fulfill that job. All right? Okay, I'm going to show you one very important one. Okay? We'll take your glasses off. Have your lie face down, please. Okay, so let's adjust this so you can put your face there. Now, gluteus maximus, very, very important. We're going to test your left glute max, and I'm going to ask you to lift your legs straight up, and you'll notice your toes pointed straight down, almost straight down, okay? It's not turned out this way, all right? It's this way, all right? I'm going to put pressure, resist as I push down. And again, push up. Okay, do you engage that all right?
Yep.
All right, you want to try it once more, please? I want to make sure. So when I turn your toe inwards, it makes it harder because it localizes just the glute max. Push up. And you do great. Now we're going to do the same with the right side. Remember, your right side we think is compromised. All right, hold there as I push down. You want to try that again, Robert?
Yep.
And push up. There's nothing, right?
Yeah.
Okay. I'm going to grab a device. This is one of the ways we test to see whether the SI is definitely the problem. So we slip a device, one device, over your right SI joint. So let's lift this leg up again. Hold there as I push down. Any difference?
Stronger.
A lot stronger. Hold there. And okay, very good. So we know that it has to be the SI joint from our testing. And secondly, we can make our weak muscle and your muscles aren't weak, they're just not engaging. An unengaged muscle fire when we put a device over your SI joint. So it's another way of testing. All right, so let's treat that SI joint because it isn't treated just because I laid a device on it. You have to touch the SI joint and another one over the motor cortex and run it like this, and now it's done. All right? Now, let's test the glute max. Hold that leg straight right there and resist as I push. And now it's strong. Now, turn onto your back, please. Very good. Now, let's test your right Sartorius. Hands to your side, because we want everything that supports your knee to be firing on all cylinders. And hold there as I push. Do you feel how easy it is to engage now?
Yeah.
Yeah, it's really easy to engage. All right, now sit up for me. All right, so hands across here like so. Turn your body to the left. We're going to test these obliques. Okay, All right, so it's easy for you to engage. So I would say, Robert, that your problem is multifold. You have a medial talus because you got a flat foot on this side, and it causes a distortion of how you use your knee because the muscles are being switched off by your SI. Your SI is being switched off possibly by the talus. Who knows? Either way, when you treat yourself each day, you want to stand up for me? This is the pattern you should engage every day. So you hold one, just turn your back like this. We'll put one on the top of your head, okay? Hold that there with your left hand. Left hand, that's good. And now I want you to rub this one over your SI, okay? Every day you need to do that, whether you have large clips or the small clips, doesn't matter. Now I want you to do your medial knee, holding that there, that's right. And you should always do your medial ankle. So you're resetting the nerve receptors in your ankle. But what you may ultimately need is orthotics to support your ankle a little bit better, especially when you're weight training. If you don't have orthotics, I hope you have really good shoes that support your foot and you lace them up really well. So you're supporting that arch as much as possible when you're working out. Okay?
Okay.
Thank you. Appreciate it.